Africa molweni. I am back in studio, fresh from an oversight trip to a number of provinces across South Africa, where I was able to get first-hand insight into the preparedness of health facilities to roll out mass vaccinations. I will give you an exclusive briefing on what I discovered and will reflect on what to expect as South Africa nears the supposed start of mass vaccinations. But first, we take a look at the week in headlines.
Last week, ANC President Cyril Ramaphosa admitted to the Commission of Inquiry into allegations of state capture that something had gone, quote, horribly wrong in the party in failing to act against corruption red flags.
Ramaphosa admitted that state capture happened, but didn't offer any information on who should be held accountable.
Government has brought in 24 Cuban engineers to help address water infrastructure issues as well as to share their expertise. But South African engineers are calling on government to prioritize them. This especially those who are currently unemployed.
We are all, I suspect, wondering what ANC Secretary General Ace Magashule will do today. His 30 days step-aside grace period comes to an end.
The 30-day deadline is up, but no one is going to step aside for now. That's the message from the ANC.
The High Court in Pretoria has interdicted the government from processing applications and making any payments from its 1.2 billion rand tourism equity fund.
The Democratic Alliance is among those raising the red flag on power shifts. Recent allegations about the alleged involvement of family members and those close to Energy Minister Gwarube and senior officials of his department in the bid process should be investigated.
This week in the headlines, the president dodges and dives questions before the Zondo Commission. Minister Mantashe strikes a dodgy power ship deal, and the High Court rules against racist government aid policies. Last week, the North Gauteng High Court handed down a very important judgment. This judgment stops government from using illogical racial criteria to disburse government's 1.2 billion rand tourism equity fund to struggling businesses in the wake of COVID-19. The use of racial criteria for relief funding is a clear indication that the ANC is not serious about saving livelihoods. The DA has long advocated for this fund to be more inclusive of all businesses in the tourism sector affected by the economic crisis. Ultimately, our goal is to save both lives and livelihoods. On the topic of saving livelihoods, South Africans commemorated Workers' Day on Saturday. Mzansi's greatest asset is its people, who are always prepared to work hard to realize our country's potential. But the ANC profoundly failed us. Unemployment has risen to 42.6%, one of the highest rates in the world. South Africans urgently need change, and the DA remains the only party able to provide that. President Cyril Ramaphosa delivered his long-anticipated testimony before the Zondo Commission of Inquiry last week, focusing on the ANC's Cadre Deployment Committee. Unfortunately, instead of honesty, South Africans only got ANC spin. Ramaphosa evaded the real issues and doubled down on the ANC's cadre deployment policies that are at the heart of corruption and service delivery collapse. The DA has now requested that the Commission uses its legal powers to urgently subpoena the full record of decisions made by the ANC's Cadre Deployment Committee since Ramaphosa became its chairperson back in 2013. The president and the ANC cannot be allowed to evade accountability for decisions that have profoundly damaged South Africa's public service. Last week, the deadline for the ANC Secretary General Ace Magashule to step aside passed. And instead of dealing with this matter decisively, the ANC's National Working Committee continued to dither and issue meaningless letters instead of pursuing meaningful accountability. In the meantime, Ace remains firmly entrenched in his all-powerful position. Like Zuma's dodgy nuclear deal, Minister Gwarube has his 218 billion rand power ship deal, which reeks of corruption. The deal locks South Africa into a 20-year contract to purchase expensive, dirty power generated by these ships when clean, renewable energy gets cheaper and cheaper every year. These ships have no place in South Africa, and we will get to the bottom of this fishy deal. The DA will continue to fight for a low-cost, reliable, clean energy supply for South Africa. The DA has called on Minister Lindiwe Sisulu to reverse the appointment of 24 Cuban engineers to assist her department. The minister forgets that in order to work in South Africa, international engineers are only allowed to carry out work if they've been registered locally. This makes their appointment not only illogical, but potentially illegal too. The minister also seems to forget that South Africa has many skilled but unemployed engineers who are only too happy to offer their services. Yet, government chooses to spend millions to import and house and pay Cuban engineers at the expense of accredited and experienced South African professionals. In the spotlight this week, having visited hospitals and clinics across the country, we reveal how equipped South Africa's health facilities are and whether South Africa is really ready to begin mass COVID-19 vaccination outside of the Johnson & Johnson trial for healthcare workers. Let's take a look at this story in the spotlights.
There is much concern among some experts in South Africa that government's pace of vaccine rollout will not delay the third wave of COVID-19 infections.
South African scientists recently said it was, and I quote, shockingly deplorable that South Africa still has not secured a COVID-19 vaccine. They also said it's distressing to hear senior officials talking down the usefulness of vaccines and the prospects of its availability in the country.
The need for a vaccine is now more urgent than ever.
A group of health experts criticized government for dragging its feet on a vaccine and lacking transparency.
South African citizens are facing probably the biggest health crisis in democratic South Africa after the HIV/AIDS pandemic. I don't think government has been nearly transparent enough with citizens.
I'm wondering whether or not we have the infrastructure, the competency and the conditions to actually reach this perceivably very ambitious target.
South Africa is now seemingly unlikely to reach its 2021 coronavirus herd immunity target.
The news is that we will not meet that deadline.
For us, commemorating this particular Workers' Day means putting a particular spotlight on government's shoddy and very much criminally slow rollout of the vaccine of COVID-19. This past week, I conducted oversight visits across the country with my colleagues in the provinces. The intention was to assess the readiness of vaccination sites across the country. During the tour in Gauteng, the Eastern Cape and KwaZulu-Natal, it was crucial to assess that we have sufficient cold storage capacity, that health systems are prepared, and that the staff are ready for this critical phase of rollout. The reality is that South Africa's vaccination plan has been a spectacular failure to this point. What we can ill afford is provinces and facilities not being adequately prepared to roll out mass vaccination program. During these visits, it was clear that we have a long way to go. We found that healthcare, particularly primary healthcare facilities such as clinics and smaller hospitals, are in fact the weakest link. In particular, in certain facilities, there is inadequate cold storage capacity. These are the fridges that will be needed to store these life-saving vaccines. Little to absolutely no communication on vaccine registration to communities. And in one instance in Johannesburg, all I could find was a note that was nailed to a tree outside the clinic, and that was the extent of that communication. The lack of security for vaccine storage, making it easy for criminals to commit theft and endanger the lives of healthcare workers. And lastly, inadequate infrastructure and human resources to be able to house a full vaccination program. Any additional patients at these clinics could result in them being super spreader hotspots. These inadequacies expose the very real possibility that facilities could be overwhelmed once mass vaccination commences, especially as the country inches closer and closer to a third wave of infections. The possibility is that we could also have an incredibly low uptake of the vaccine due to the lack of awareness. And that is why comprehensive public awareness campaign is absolutely critical, given that we are just 2 weeks away from a scheduled rollout. How many radio ads have been placed? How many print ads in community newspapers have been placed? Are South Africans aware that they need to register online to be able to get a vaccine? It is absolutely bizarre to us that none of this appears to have happened, despite the fact that the minister and his department have spent 82 million rand on a communications contract. This week in the Spotlight, we asked the question, is South Africa ready for its mass vaccination rollout later this month? And from what I've seen on the ground, the preparations definitely don't match up to what government and what national government has been claiming is happening. To discuss all of this and more, we are joined in studio by DA leader John Steenhuisen, the DA Shadow Minister of Public Service and Administration, Dr. Leon Schreiber, and I'm joined via Zoom by the DA Shadow MEC for Health in the Eastern Cape, Jane Cowley. Welcome, everybody, and welcome back to the studio.
Great, Siv. Great to be with you again, and great to be with Leon and, of course, Jane by Zoom.
Absolutely. John, I'm going to jump straight into it. We have been, and you in particular have been on record having said that the lack of a vaccine to South Africans is a violation of basic human rights. And what would you say, how would you say we have fared in this regard as a country?
I think we fared incredibly badly. And the fact that there are many, many countries, not only around the world, but also on the African continent, that are light years ahead of South Africa in terms of rolling out these vaccines. The reality is, as we sit today, government promised us 1 million vaccines in March. They barely made it to 200,000. We were promised all healthcare workers were going to be vaccinated. There are still 800,000 healthcare workers around the country who remain unvaccinated. We have citizens who have got no idea when they're going to get the jab in their arm. This is an unmitigated failure of government. It is probably the biggest human rights violation, I believe, in post-democratic South Africa that we have seen. A government that, through its own inaction, its own incompetence, and its own inability to be able to do what it should be doing, is actually putting people's lives at risk. And I think that this government is going to have to take accountability for the deaths, which will be unnecessary deaths, of those who are hit by a third wave. And we know there's some new strains coming in from India and the like. We are going to face a third wave. We're going to winter. All those deaths could have been avoided had the government got off its hands last year and ordered vaccines. That's what countries around the world did. It is a disgrace that as we sit here today, we are behind Zimbabwe on vaccine jabs and arms. And that's all that matters. Now, the president can talk about secured and that. It's jabs and arms that make the big difference. And until you can get jabs and arms, this country remains at great risk, and government is accountable.
I was actually just going to follow up on that to say, we've been almost hoodwinked into believing that we should be celebrating these little milestones. We've secured here, we have, we've signed a deal here, we've signed a memorandum of understanding here, and we've been almost made to have to celebrate those little milestones when, in fact, actually the real number is 350,000 healthcare workers.
I think it's very odd that government expects citizens in a democracy to accept absolute failure and be thankful for it. I don't regard any of those announcements as something we should be proud of. Of course, it's a natural market function. It's supply and demand. Of course, vaccines are going to become available more now because many other countries are already almost completed their vaccination process when we're still to put a single government jab in a single citizen's arm here in South Africa. Countries like Israel, mask wearing is no longer required because they reached the critical number. Placed in the UK, they're getting back to business. The US, United States announced by the 4th of July they're going back to normal. And many of our African peers are going to be in the tail end and seeing out there and starting to rebuild their economies, where we're still going to be at the beginning of a vaccination. There is nothing to celebrate about the rank incompetence, callousness and carelessness that this government has shown over the coronavirus pandemic.
Absolutely. Leon, I want to bring you in here because over and above securing vaccines, there's also obviously the machinery of being able to roll out a vaccine. And part of the reason why this has been so poor is because actually our public service is almost broken. Talk to us about what you think a failed state looks like and how this has impacted our ability to respond to this pandemic.
Right, so I think definitely some of the things that we just saw in that clip, the sign pasted on a tree outside, that's your communications plan. I think that is evident and really shows the consequences of a state that has been systematically hollowed out for a quarter of a decade now. And if you look forward a little bit, you don't have to be Nostradamus to predict that the world is going to start opening up. Excuse me. And South Africa is going to be potentially locked out from an increasingly vaccinated world. That's the scenario we're looking at, not years from now, but potentially months down the road. And, you know, it's not only the vaccine program. All of the issues we're seeing in municipalities, crumbling infrastructure, potholes not being repaired, failed service delivery in ANC municipalities, these are all part of a system, and the key behind this system is a policy called cadre deployment. And what the vaccine crisis has done, it has not created the crisis in the state, it has exposed the crisis in the state, unlike anything that we've seen before. And that's why it's so important that we've had this testimony from the President last week about cadre deployment, because it comes in the midst of a crisis that shows just how badly our state has been damaged. And that's why it's so disappointing that the President, instead of saying that he's going to walk away from the policy that is explicitly designed to appoint people on the basis of political loyalty rather than on skills, merit, and their ability to do the job. That is why we are in this mess. And if you ask yourself a basic question, how is it possible that the health department could not have planned ahead to make sure that South Africa has the jabs in arms, has the vaccine supply, and has a proper rollout plan in place? The answer is because the people who were appointed to lead the department, like so many other government departments, are politically connected, and they care more about servicing the needs of the ANC as a political party rather than the people of South Africa.
And John, I mean, and when you've got a situation like that, I mean, I feel like in a health department, it actually boils down to life and death. It's not just one of those things that if you've got rank failure because people aren't appointed on the basis of merit, you can somehow make up for it. But if you fail in the health department during a global pandemic, people die.
Absolutely. And I think people forget that it is one of the most basic functions of government. And before you start dealing in foreign policy and all these procurement, keeping your citizens healthy and alive is any government's primary function and responsibility, because you cannot realize any of the other rights in a democracy if you are unhealthy or if your life is in danger. So government has failed so fundamentally, spectacularly in this regard, and has put many, many citizens' lives and livelihoods at great peril. But we must not forget as well that it's not only coronavirus. This mishandling of this pandemic has crowded out HIV/AIDS treatment. It's crowded out tuberculosis treatments again. And I've no doubt that there's going to be an uptick in HIV cases as well as TB and other diseases like that, because the crumbling health system just cannot cope, even with keeping citizens basically healthy. The pandemic has now put strain on it. It's completely unfit for purpose to protect and defend South Africans.
Absolutely. I mean, I was at JP Clinic in downtown Johannesburg last week, and I mean, just looking at that facility, it is so tiny that they barely can be able to roll out services on a normal day, let alone having extra foot traffic coming in for a vaccine rollout. And that's why what you have is a notice just plastered on a tree, because actually, the facility just simply cannot cope. Those facilities that look like that will simply be just super spreader hotspots if they're allowed to just, roll out a vaccine like that. Always
money to build in Kandla, always money to expand government offices and government departments and where the ministers are. But where the rubber hits the road and people have to interact with government, that's always the last priority. Whether it's courts, whether it's clinics, whether it's hospitals, that is where it is completely just an afterthought. And I think that it is a huge disgrace that we've got expect people to access services there. And the worst part is, because they're so small, many people, a trip to the clinic means taking a day off work, which means a loss of income. transport costs and the like. We do not have a people-centred government, and that is why one of our key messages about taking power away from the state and giving it back to the people of South Africa where it belongs. That starts with healthcare as well.
Absolutely. I want to turn to Jane. Jane Cowley is our colleague in the Eastern Cape in the provincial legislature. Jane and I did a number of visits in the Eastern Cape, visiting some vaccination sites. Jane, welcome to the Inside Track. Thank you so much for joining us.
Thank you very much, Sivs, and greetings to your panel and greetings to the viewers.
Thank you. Jane, I want us to perhaps just give a quick summary of what you are of the view that what did we find in the Eastern Cape, and what's the state at play when we're looking at the state of readiness of facilities there?
Thank you, Sivs. Yes, we went to two fairly urban facilities, and I was quite pleased with the infrastructural readiness of both facilities. But what worries me is we have a very rural province, and there are 5 major concerns that I have. The first is I can assure you that our rural clinics are in no way well prepared for the rollout of the vaccine. Some of these clinics, like our rural schools, still have pit toilets. They are inaccessible. There is no way that they have anything online because they're out of connectivity. So these are going to be major challenges for the Department of Health. The second and probably the biggest crisis in our province is the desperate shortage of medical staff and healthcare workers. We have a massive vacancy rate, and my great fear is that the third wave happens simultaneously with the rollout of the vaccine, because we have community healthcare workers now who have been enrolled in the vaccination rollout, and those are the people that are supposed to be doing the testing and the tracking and tracing, which has now taken a back seat. So my greatest fear is that these two happen simultaneously, because we're going to be in terrible trouble then. Another issue that I'm very concerned about, and this government is very good at talking about the plans, but implementing them is quite another story. We do not even have sufficient vehicles and transport mechanisms to get all the vaccine to the far-flung corners of our rural province. Never mind getting all the vaccinees or citizens to these facilities to get the vaccine. So I'm very, very concerned about that. And then I do believe we have a major crisis in terms of the communication strategy. We should be inundated with advertisements. We should be inundated with people being, the registration process being made clear and clarified to all the people. We should be listening to people reassuring those who have vaccination hesitancy. We should be hearing it all day, every day on all our community radio stations. The silence is deafening. And then, of course, once again, the Eastern Cape has set completely unrealistic targets. There is no way they will ever vaccinate 4.3 million people by the end of October. We'll be lucky if we've vaccinated 1.5 million people by then. And this, of course, just what's the word I'm looking for? It just reinforces this view that the state has collapsed.
Yeah. And Jane, to that point, I mean, we've seen the Eastern Cape have these ambulance scooters at the cost of over 10 million rand. We've seen the MEC in the dock for other related corruption issues around the Mandela funeral. We've seen the HOD being removed and another one that's acting. And all of these things just speak to a really collapsed province. And I mean, what is the extent of how broken that system is? And you and I went to facilities where we saw really dedicated healthcare workers. But actually the problem is not there. The problem is at Bisho, where the administration sits. And I know you've been at the forefront of exposing some of these things.
Unyansile, I'll tell you what, the greatest problem is, for example, let's talk about the scooter gate, as we refer to it in the Eastern Cape. The supply chain mechanisms were so badly flouted. They were so determined to push that tender through. And this was in the middle of June last year. Now, if you cast your mind back to June last year, our frontline workers in this province were dying in their numbers. But the Department of Health was hell-bent on buying scooters. And our frontline workers were dying because they did not have personal protective equipment. There was a shortage, a desperate shortage of PPE in this province. But they're happy to spend millions and millions that were not related to COVID funding at all, whilst their very workers were dying in their numbers in this province. You know, you can't grasp how callous that is. Then, of course, the PPE corruption itself. You know, we had hundreds of pop-up companies suddenly across the province that all tendered for the PPE distribution. They then sold the PPE back to government at a fantastic profit.
Yeah.
These were all government officials making money out of the government, you know. And then, of course, my bugbear, cadre deployment. I think it's already been mentioned. We have such a bloated administration in the health department. We have directors, deputy directors, assistant deputy directors, senior managers, general managers, assistant general managers. It goes on and on and on. We have a wage bill of 79% of the health budget. And yet our hospitals and clinics, some of them are functioning at 50% of capacity. How does this even happen? So, you know, unfortunately, it seems in our province that chaos and cadres and corruption trump commitment, capability, and clean governance. And this is what's led to this incapable state.
Absolutely. I mean, I remember you and I went to Uitenhage Hospital where the CEO was telling us that she's been acting and the person before her was acting. She's been acting for over a year and they're operating at basically like 50% vacancy. All they require is medical officers, nurses to just be able to even just do their basics. But you're sitting with a whole bloated system in the administration where people, as you say, assistant managers, assistant directors, this and this, where we don't have just a nurse and a doctor at a facility.
Correct. And sadly, this is province-wide, you know. I mean, even the rural clinics are sitting without medical officers. They're sitting without nursing managers. It's a dreadful a provincial crisis.
Yeah. Jane, I mean, before I let you go, I mean, where to from now? Because we are now inching forward to, you know, the 17th of May. We're meant to be starting with mass vaccination. As the MPL in the legislature, what are some of your key things that you're going to be pushing for? Because obviously we can't simply fold our hands and say, well, this thing is broken. We've got to do something.
Yes. So we're definitely going to be rolling out a very big registration awareness campaign. We in the DA in the province, we have a very extensive WhatsApp network. So we're going to be using that network to try and get the message out to as many of our communities as possible with all the relevant information. You'll remember, even when we were at Uitenhage, I mean, we mentioned to them, or in fact, our MPL from Uitenhage mentioned that they need to start targeting the old age homes there. They had not yet approached the old age homes. This was a week ago. So we were in trouble. So we're going to obviously be targeting that they focus on the low-hanging fruit, such as all the old age homes in the province. And then obviously we're going to push the department to make sure that they have an effective and efficient transport network so that the rural areas can be effectively covered and that the vaccines can reach the people in the far-flung corners of the province. And then, you know, I'm also pushing for sister departments to come on board because we can't approach this as a silo. Every department in the province needs to take responsibility and they all need to commit to ensuring that this rollout actually does take place. So, for example, the Department of Transport needs to come on board. The Department of Public Works needs to assist in whatever way they can. So we're really pushing for a multi-pronged approach to just get the program off the ground.
Yeah. Jane, all the very best, and we will be back on the ground with you, making sure that we hold government to account, because ultimately, even though it's not necessarily our job, we've got to step into the breach and we've got to do what we can to actually save lives, and that's why we're going to be taking up this registration issue. Leon, I want to come back to you about this vacancy rate that Jane is talking about. I mean, as I said, in the one hospital where the CEO said there hasn't been a permanent CEO here, and they literally don't have enough doctors to go around. When people retire, they can't. They have to literally apply at Episho to get approval to even hire somebody to clean the clinic. So it's become such a complicated, convoluted system that literally service delivery is not happening on the ground. And you've been speaking a lot about millionaire managers versus service delivery on the ground. Talk to us about that.
Yeah, I just want to add, I think, that, about 18 months ago, there was a report from the Eastern Cape Health Department, shortly before the COVID crisis really hit us, that one of the major hospitals there, the CEO of that hospital had not been appointed for a long time, as one of the stories we've just heard. But the reason for that was that the MEC was waiting for approval from Ace Magashule, the ANC Secretary General. Now, that shows you the pernicious effect that cadre deployment has on everything that we've just heard from Jane there. But then linked to that, and this idea of the civil service as something which serves the ANC and its patronage network, is the fact that we have such a top-heavy civil service. And that's also where the problem with the wage bill comes in. So, last week, Minister Senzo Mkhunu went public, clearly out of ideas, asking, can people please come up with suggestions on how to solve this? And the DA has now submitted our plan to him, and it's all premised on this idea that we have 29,000 millionaire managers in our civil service. That's almost 30 billion rand a year that we're paying salaries for these top managers and the administrators that Jane talks about. But at the same time, we have vacancy rates of up to 15% in our frontline departments like health and education. And whereas the administrators and the millionaire managers are overpaid compared with the private sector, you'll find that our frontline healthcare workers and people like police officers, teachers, are actually underpaid. So it's a top-heavy structure that reflects priorities that are created to employ cadres in management positions and then make sure they get fat salaries, sometimes over 2 million rand a year, at the direct expense of frontline service delivery and service delivery workers. So all of these crises have now come to a head, and the wage bill is part of this story. And the only way that we're going to be sustainable going forward financially is if we prioritize our frontline workers and staff over the 29,000 millionaire managers and cadres, and start making the tough choices that put the needs of the people first, gives power to the people through the state rather than to a political party.
I think that the problem as well is replicated at municipal level. And I've often spoken about the inverted triangle, where you've got all these, managers and municipal managers, many of whom earn more than the President of the Republic of South Africa, all these, executive heads, executive directors, but the actual, where the hand's on the broom or cleaning the street, then there's no money, then there's not enough staff, which is why there's a complete collapse in many, many ANC-run municipalities around the country, because the focus is on getting as much money for the management level, and the people actually have to do the service delivery are not being paid enough, and there's not enough of them. That's why you end up with these councils that are do-nothing councils. They take rates from ratepayers, but provide nothing in return, because even if they wanted to, they couldn't deliver because they don't have the bodies in those posts. And
ultimately, then when crisis hits, which we have, the pandemic, then ultimately now you're relying on your frontline facing employees. And then they've massive gaps where they can't do a single thing.
And it's amazing. It just shows you the lack of resilience in South Africa and how cadre deployment has hollowed out the state's ability to perform even the most basic functions. And, it is dangerous in ordinary times. It becomes deadly in a pandemic. And you've seen that. I think there are many, many South Africans who have, and we must be honest about this, who have died unnecessarily because we do not have a state that takes the responsibility to protect its citizens seriously. A state that is so obsessed with consolidating power with politicians that it long ago forgot about the people. And that is why in this local government election particularly we're saying, take power back from the incapable state and give it back where it belongs. And people can do that with their vote.
And Leon, we've been, as you said, we've long said, here are proactive solutions. You have proposed some solutions to Siviwe Mkhunu, who's now obviously out of ideas. But, there are some private members' bills that we've brought to Parliament that we've really tried to really rectify the situation.
Yes, indeed. And in fact, the DA has got a solution on the table right now. It's been gazetted. Our intention to introduce the End Cadre Deployment Bill has been gazetted in Parliament. And we are currently running a campaign. We've got petitions going around, and we're asking people to make their voice heard so that Parliament takes active steps now on the basis of everything we've seen. We really don't need more evidence. So we've got the Zondo Commission, we've got the COVID crisis, we've got reports on the state of municipalities. We know what the problem is. It's called cadre deployment. And it's the wage bill and all these crises that flow from this system. So it is time for South Africa to not only understand the problem, but actually to take the steps we need to fix it. And the end cadre deployment bill will be a huge step forward. And that's why we're calling on all South Africans and all political parties who actually want a state that serves the people to support this bill going forward.
And that's something that really surprised me the most. I mean, and Leon and I went up to the Zondo Commission to eyeball to listen to the president. And during the lunch break, he asked me if I was there because I was a fan of his, and I said no. He said I'm here to get the answers to the questions that he's been ducking for 10 years. But it was very, very interesting to see there his inability to accept cadre deployment. He said, I'm not prepared to throw the baby out of the bathwater, and there's been a few mistakes. Well, Dudu Myeni, Brian Molefe, Shlaudi Motsoeneng, Sean Abrahams, Lucky Montana. There have been a litany of devastating theft of public money as a result of this policy. But what worried me was his inability to walk away from it. Surely, as a politician who has the best interests of the country together, you say this hasn't worked, it's caused destruction, it's robbed opportunity, it's robbed young people of their future. Now's the time we walk away from it. Instead, he doubled down on it. And I can tell you right now what's going to happen if this policy remains in place. We're going to have another commission of inquiry in 10, 15 years' time. But this time it's going to be looking at how Cyril Ramaphosa deployed his cadres into these key positions. That's why Leon's bill is absolutely essential, because it will end cadre deployment at every sphere of government and will end it for good no matter which party is in power. And that's an important point to make.
Absolutely. And also, I mean, I think now, John and Leon, we are now faced with possibly the largest public health response we've ever had in the country that we've got to roll out in the next 2 weeks. All indications show that either through vaccine, whether inadequate vaccine availability, or the system is just entirely too broken to be able to roll out a vaccine at a fast pace. I know you'll be asking the president some questions in the House this week, but I mean, what are some of the key things that the president needs to prioritize?
Well, look, I mean, what we're going to hear a lot from the president tomorrow is big numbers. We know the president likes big numbers. He likes announcing the 100 billion rand investments that never materialize.
I think he's trying to out Jacob Zuma.
Yes, Well, look, I mean, at least he can pronounce them, which first makes some difference. But, you know, he's always the one to announce the big numbers. But let's drill down. So let's just drill down to this number that he's talking about, 350,000 vaccines per week. If you take that out, and even with my matric maths, it's going to take 2 years. It's going to take 2 years to reach the 40 million mark. So who is he fooling? You know, he expects us all be grateful that we're going to have 350,000 a week. We should be vaccinating that every single day in South Africa if we're to catch up with the run rate required to get on top of this particular vaccine. And so I'm sure tomorrow you're going to hear big numbers. What he needs to tell us is when are the vaccines arriving and how are we going to get them into arms as quickly as possible.
Absolutely.
Now, he promised us 1 million at the end of March. They didn't come anywhere close to that. If I was him, I'd be getting the private sector involved. I would be getting government's stranglehold and grip off this process out of the way and unleashing the power of the private sector into assisting with these things. If South African breweries can deliver black label or beers to the most rural parts of the Eastern Cape, let's unleash their supply chain management system to help us get vaccines there. Let's get private healthcare providers to roll that. If government continues to hold on to this, like they've done with an airline that doesn't fly, an electricity service provider that can't keep the lights on, you're going to have a vaccination program that never gets off the ground. And people are going to die unnecessarily because of this.
And I mean, just lastly on this, a little segue, Leon. As John said, you know, the president was unprepared to walk away from this. And do you think that perhaps he just doesn't have the power to put his foot down in the organization, or perhaps he's complicit?
I think the president used a very interesting phrase during his testimony last week. He made it very clear to Judge Zondo at some point that he is a party man. Those are the words that he used. And I think within that concept is the answer to that question. We have repeatedly seen the president, when crises manifest, trying to paper over the cracks rather than admit that the ANC's needs and the country's needs are divergent from one another, and then choosing the country over the party. And I think when you have a president who goes in front of a commission like that and makes the extraordinary statement that I'm a party man, therefore I'm not walking away from a policy that's so clearly damaging South Africa, even in the midst of this healthcare crisis where people are dying unnecessarily, it tells you something about the ideological commitment that goes beyond fact or reason or reality on the ground, and is so obsessed and committed with this idea of the ANC's national democratic revolution, and it needs to control all levers of power. That's what cadre deployment is about. And the inability and the failure to walk away from that, I think that is a very clear warning sign to South Africans that President Ramaphosa has exposed himself. And I think we're going to see more testimony from him next month. But if we go from what we've seen thus far, we're seeing that the president's words have been empty, and he's actually exposed himself as a party man, not a South African man.
John, I mean, this anyone listening at home would be excused, would not, before being incredibly depressed about the state of play, whether it be a slow vaccine rollout or a system that's completely collapsed or a president that really couldn't be bothered by South Africa. I mean, the DA has been proactive in tabling solutions too. So, I mean, people will say, but I mean, what can you do as the official opposition? And this question comes up quite a bit. So I do want you to talk about the steps that we've taken, but also what can we do?
Well, that's something that frustrates me the most about the commentariat in South Africa. They always say, oh, well, the DA criticise, but they don't have plans. Not only have we tabled plans, and these include how we could improve the rollout, getting the private sector involved in managing the rollout, making sure that we bring on board industry role players who have cold storage facilities to be able to assist with the storage and distribution of these vaccines. We've demonstrated it where we govern. So even the most basic things like a field hospital, Gauteng was digging graves. Alan Windey and his team in the Western Cape were building field hospitals. The Eastern Cape, they were buying these ridiculous scooters. We were buying oxygen and PPE. And that is the difference, that it doesn't have to be this way. And people must understand that there is an alternative, that you can change things in South Africa, but it comes down to using your most fundamental power, and that power is your vote. If you're not voting and you're complaining, you're essentially helping the status quo stay in place. So it is through citizen action that we're able to do it. And we've been able to demonstrate through the COVID-19 action plan for the incapable state that we gave government, the Blue Book interministerial response to how you could prepare for COVID-19, our differentiated model, our smart lockdown system. All of these things had government been implementing them, rather than trying to pick holes in them just because they came from the opposition, I think South Africa would be in a far better place than it is today. And I think that this local government election is going to have to become a referendum on government handling on the COVID-19 vaccine crisis. Because if you've got a family member that has died from COVID-19 in a hospital where there was no oxygen and there was no nurse facilities, how can you vote for a government that has essentially killed your family member? People have got to understand that there is an intrinsic link between how you live and how you vote.
Absolutely.
And we've demonstrated. And Ratings Africa this week, the Auditor General's reports all show DA-run municipalities, DA-run provinces, clean accountable administration means an improved life for people, including healthcare. Nobody in the Western Cape, not one single citizen who needed a hospital bed or oxygen was not able to get it. That cannot be said for any other province. Is a way link between how you vote and how you live. So there is hope on the horizon.
Absolutely. And I mean, just as a conclusion, I think it's also quite important, John, to say this is the reason why as a DA we have not supported postponing the local government elections, because ultimately we're of the view that you need to elect a government that will work for you. Hire and fire your government through the ballot box.
Absolutely. And I can see why, the ANC doesn't want to go to a local government election. And you've got Twitter and Mboweni tweeting out these, the stuff out from Machuberskloof, obviously enjoying some of the natural products of the area, but, around why, we want to postpone the election. I would hate to be a government going into an election with a 42.6% unemployment rate, the complete bungling and mishandling of a pandemic that has had deadly results for many citizens, and service delivery failures wherever you look. And that is why it is fundamentally important as citizens we understand that one of the key cornerstones of any functioning democracy are regular elections.
Absolutely.
If you allow government to push out the election now because, oh, well, there's, coronavirus, etc., I can tell you the next time government's in a tight spot, they will find some excuse to say, well, let's postpone the national election.
And there'll be precedent.
And there'll be precedent. They'll say, oh, well, we did it during corona, let's do it now. And that's how you end up in a totalitarian dictatorship, because suddenly the elections go from 5 years to 7 to 10 to 15, and then they stop happening altogether.
It's a dangerous, slippery slope.
It's a slippery slope. And that's why we've been very clear. We want this local government election later this year. We're ready for it. And we're going to kick off our campaign with our Time for Change rally on the 22nd of May, so that we can demonstrate to South Africans precisely what we've been talking about, that there is a better way, that it doesn't have to be like this, that we can have a united, prosperous South Africa with a growing economy that's more inclusive. We can have safe communities. We can have schools that teach our children and prepare them for the future. But we can only have those things if we're prepared to vote for them.
And if you lend us your vote.
And you lend us your vote. Yeah.
Absolutely. Gentlemen, thank you so much for joining us. We will be right back. And cities across the country. The DA-led Tshwane upgrades the iconic Refilwe Stadium after years of ANC dereliction. 195 families in Hanki received electricity for the first time thanks to DA-led Kucha's electrification program, and the DA-led Nelson Mandela Bay's Council is in the process of constructing its first seawater desalination plant. Today on DA at Work, we are joined by James Force, the Mayoral Committee member for Economic Opportunities at the City of Cape Town, who will tell us more about the city's recently launched Jobs Connect program. Thank you, James, for joining us today, and welcome back to the Inside Track. I would love to jump in and talk to us about the Jobs Connect program. What is it about and what has it managed to achieve?
Well, we've opened a new and exciting chapter in Cape Town by launching the Jobs Connect program. It's a workforce development program that will connect Cape Townians with job opportunities by providing the right skills and training, and also provide companies with skilled workers that they need to grow their businesses.
Yeah. And I mean, what is also quite important is that the city also does a lot of work to create an environment for this business to actually grow so that they can be in a position to hire people.
Yeah, so the Jobs Connect has two distinct purposes. One, to link businesses, especially companies and SMMEs, with the talent and skilled workers that they need. And secondly, for job seekers to be trained with the right skills to be able to work in those different sectors. So often in my interactions with business, they tell me about the struggles that they face to source the right talent and skills. And at the same time, we have thousands of people that are hungry to work, who don't have the right training or education for various reasons, or simply don't know that opportunities exist. And so through the Jobs Connect program, we aim to do workforce development programs, and at the same time connect those job seekers to the companies who need those new skilled workers. So it's a win-win for companies and for job seekers in our city.
Absolutely. I mean, John, this is why it's also important to be able to govern in municipalities, because you can do things like this.
And look at the fundamental difference in philosophy. And I want to talk to James a little bit about this, because it's a fundamentally different approach to any other city in the world, in the country that's run by the ANC. This is a partnership with business, treating business as a partner in economic growth and development, not as an enemy. And look at what it's been able to yield. Unemployment rates in the city of Cape Town, the Western Cape, are the lowest anywhere in the country. And just talk us a bit through this philosophy about how it's the creation of this enabling environment as a partnership that is actually behind the creation of jobs and getting people back into work.
Well, I think it's at the heart of what we do. So as a city government, we stand ready to partner with the private sector in unlocking skills and jobs in those tradable sectors, from clothing and textile, marine manufacturing, food and beverage, call centres, and many others. Don't forget hospitality and tourism, because it's one of our key sectors in Cape Town. So we work very closely with our strategic business partners in each one of those sectors, where the city provides funding to those strategic business partners to help with training and job placement in each one of those sectors, because as a city government we can't do it alone. And so we realize that the power of partnership will not only unlock the jobs but also attract new investment into each one of those sectors, so that we give companies a compelling case to invest in Cape Town. And so we've seen in 2020 11.27 billion rand worth of new investments coming into our city. We've created more than 7,500 new jobs in those specific sectors. And so therefore it makes absolute business sense for the city to work with private sectors and also the strategic business partners in each one of those key sectors, because those are the high growth sectors. And so we need to create skills pipelines into each one of those sectors so that we make Cape Town a business destination, and also giving companies that compelling reason to invest here. And don't forget, we have set up dedicated units within the municipality to look at our investment facilitation, our incentives for new investments, our enterprise development unit. So each one of those units have a very specific role to perform. And of course, our small business support unit, where we've now assisted more than 2,800 small businesses with their smart procurement and supply development training. And those are businesses that can now compete for big business, because between 60 and 80% of new jobs created come from existing businesses.
Siviwe, and I saw this in action. I was very lucky a few weeks ago to go with James and some of the team to look at some of this work on the ground. And it is amazing to see one of James and his department's projects is transitioning people from becoming small traders to becoming big traders. So we visited a site with two incredible ladies who had built up a very good small local grocery business. Partnering with Pick and Pay now, they own a Pick and Pay, a Pick and Pay franchise store right opposite the taxi rank. And to go and just talk to them and see the pride that they have, that they actually now own a Pick and Pay store that is expanding and growing, and they get the expertise from that. It was really incredible to see those two ladies who've come from very difficult circumstances, started out as small traders, and have now become supermarket owners. And
that's the thing, John, right? It's the thing about jobs. It's not just about the numbers, right? It's about the people behind the numbers. It's about changing people's lives.
Absolutely. It's about, for every job you create, you're giving a family an income and an ability to get up onto the opportunity ladder and move forward. And that is why, James and his team and the province here are so obsessed about creating this environment that gives people opportunity to advance themselves and to be able to build businesses. Because James knows, and the province knows, that when their business grows, they will hire more people. It's a natural phenomenon. Your business grows, you've got to take in more staff. The more we can help and incubate those businesses, the more people we can get employed where we govern.
Absolutely. And James, with Jobs Connect, with Jobs Connect, I mean, how many people have what has been the success rate? How many people have we managed to get into job or work opportunities?
Well, don't forget that the city's Department of Economic Opportunities is only 3 years old. And since then, we've introduced this workforce development program. and we have recruited and assisted more than 30,000 people thus far, and we have trained more than 11,000, and 6,000 of those have been placed into jobs. And now with the new Jobs Connect program, we aim to do much more, because now we will go digital, where people can simply apply online. You can load all of your information on the digital platform. You can do all of the courses online, because don't forget, Jobs Connect is also to make our workforce job ready.
So and attractive.
Absolutely. So that companies can then source the talent and skills that they need. And so through Jobs Connect, we will make Cape Townians job ready. So it's really taking it to the next level. So that 30,000 I spoke of, I'm looking forward to many more. And that's why it's at the heart of what we do, so that we can change the economic geography of Cape Town. John mentioned this township economic intervention where we've done the spaza shop conversion. There are many more examples, and those are the type of programs that really excite me about the future of jobs in Cape Town, because this is the DA difference. This is the DA delivery. And so we're going into townships, we're working with existing businesses to convert their business into a prosperous business where they can do much more trading and employ more people by providing the right skills and the right infrastructure. And that's what you expect from your government.
Absolutely.
So those are the projects that really excite me. And also in terms of our business expansion, that's another thing where we're supporting existing businesses to become much more successful in terms of producing proudly Cape Town goods for the world market, so that we can become a city that exports more instead of only importing.
Absolutely. And I'm just obsessed about, the restoring of dignity of it all, because I think it's quite important that people, somebody with a job is somebody who has dignity and somebody who can support an entire family. But I want to talk about Amazon quickly before we wrap up. Apparently, Amazon is establishing its South African headquarters in Cape Town. What made Cape Town attractive to this global entity?
Well, we live and work in a vibrant city filled with a lot of ideas, talent and innovation. So it makes perfect sense for Amazon to choose Cape Town. But obviously there's a lot of work that has gone into it. And so for a number of years, my team and I have been working with Amazon, landing that investment. First, we have assisted them to set up their data centers in Cape Town. And that obviously opens up a lot of new opportunities, the multiplier effect, because the data services become a springboard for their operations. Now with their Amazon headquarters, we can expect many more thousands of jobs coming out of the construction, but also the Amazon web development, because that's the thing that really makes Cape Town different from any other city, because we invest in tech skills. So through the City of Cape Town, we fund the Cape Innovation and Technology Initiative. And through that program, we train Cape Townians in technology, web design, development, software development, coding, so that we can make sure that Cape Townians are ready for future jobs. And so when an Amazon makes a decision to move their headquarters here, it makes business sense, because it will drive demand to Cape Town, and also because of our connectivity, our sound governance, our infrastructure, because you must look at the whole package, what we can provide as a city. So it's about its people and it's about the place, the two P's, people and place. And that's why it would make sense. And so we look forward to many new jobs coming out of that investment. And of course, also for the e-commerce. So it's the web development, it's the data, and of course the call center jobs. Because over the last number of years we've established in Cape Town many new call centers through the city's involvement. We have now more than 60,000 people employed in call center jobs in Cape Town. So Amazon bringing a lot of jobs on the website, but also on the call center side. So it's really an exciting time for Cape Town, because we want to be the go-to city in Africa for travel and trade. And so therefore we stand ready to work with private sector to help land these investments.
Absolutely. John, I know that your big message for this past Workers' Day, which was on Monday or Tuesday. On Tuesday.
Yeah.
I know that your big message on Workers' Day was around making sure that we create jobs in South Africa. And so, it's obviously heartening to see that the DA government is really, really living up to that. But I mean, it's also going to be a big message for us going into the election, because we believe that we need to get people to work.
Absolutely. It is not sustainable to live in a society where 42.6% are unemployed. Where 65% of our youth are unemployed. It's not sustainable in the long term. We've got to help grow the economy and get people into work. We've got to get South Africa working and get South Africans working as well. A job is, as I said earlier, that first rung onto the ladder of opportunity. You're able to then pay for your municipal services, get your child to a decent school, be able to feed your family. It is a basic source of dignity. And there is no better empowerment policy for anyone in the world than a job. A job is the most empowering source of being able to get people advanced as a society. And that's why I'm so excited to see the philosophy playing. And it's not just in the city of Cape Town. You follow it. Where good governance and partnership with business and creative environment goes, jobs go.
Yeah.
So whether it's the Heineken and Ferrero Rocher factory in Midvaal, whether it's Amazon here in Cape Town, more and more businesses are flocking to DA municipalities because they know that they're going to get a government that's good governance, clean governance. They're not going to be giving backhanders all the time. They've got a reliable electricity and water supply, and they've got access to an environment where they're able to draw skilled workers from. Imagine if we can do what we're doing in Cape Town and Midvaal for the whole country. So if you're out there at home and you are desperate for a job, if you're one of those people who've given up looking for work, please understand help is on the way. And that help is in the local government elections and giving your vote to a party that's going to fight for you and not for the politicians. A party that gives you the power back and not a party that accepts power for power's sake as government. We want to put the power back into your hands. The best way to do that is by getting you back to work, giving you clean, accountable government that works for you, not the other way around.
Absolutely. James, thank you so much, and thank you to the work that you're doing. Is that the poster?
This is the poster.
I think there's going to be a few ANC councillors that might need that after the election.
Exactly.
Well, that is amazing. That is amazing work. Congratulations to you and your team, and keep doing on the good work. And we will be back after this. Africa. If you are over 60, please remember to register online or at your nearest health facility to access your COVID-19 vaccine when it becomes available. And now for some exciting news. On the 22nd of May, the DA is hosting the largest virtual rally ever seen in South Africa, the Time for Change Rally. Remember to pledge to get behind the change South Africa needs at timeforchange.org.za. And tune in at 10:30 on the 22nd of May for performances from top South African artists, along many other exciting surprises. Until next week, keep it tight, Mzansi.